Te Whatu Ora, Health New Zealand and Te Aka Whai Ora Māori Health Authority has revealed the first national plan, Te Pae Tata, and its priorities for the new health system over the next 2 years. Health Minister Andrew Little said workforce and improving equity and outcomes were key priorities in the interim plan announced in Taupo Hospital on Friday morning. However, National's health spokesperson Dr Shane Reti says a major health restructure in the middle of a pandemic has added more pressure to a system in crisis. Dr Shane Reti, who affiliates to most Northland iwi, is with us now. Tēnā koe, Dr Reti, thank you for joining us.
Tēnā koe, Neil. Good to speak with you.
The government promised a radical shake-up of the sector after abolishing district health boards. Is the plan the answer?
All that's happened is things have got radically worse. That's the only radical thing that's happened. Waiting lists have increased. The default now to see a specialist, it was 4 months, it's now 12 months. They're only looking at those on the 12-month surgical list for receiving surgery. And the plan itself that was announced is a disappointment. It's more of a discussion document. We need a crisis plan. The sector's in crisis, not a discussion document. Nothing for rural health in this plan, and good luck finding anything around emergency department wait times. So disappointing, doesn't address the immediate need in front of us right now.
Well, these reforms are supposed to help address poor access to healthcare. How do you feel this plan serves Māori and people in rural areas who don't have the same access as city folk?
So if we look at the plan, it says that it won't be fully deployed for another 2 years. Really? You've had nearly 2 years to work on it before its implementation 1 July. You spent tens of millions with Ernst Young to implement it. Why are we being told there's another 2 years? Oh, and by the way, the Māori Health Authority in their regulatory documents said there'd be no health benefits for Māori in 5 years. We have a crisis now. We need to give hope to people waiting in EDs today, to people on waiting lists today, to those who need to see a specialist today, not a discussion document.
Dr Reti, the interim plan includes embedding Te Tiriti o Waitangi across the health sector and setting up a new Te Ao Māori whānau-centred maternity and early years service. How do you feel they'll be able to help address inequity?
So there's absolutely no doubt that if you treat people in a culturally competent context, you get better outcomes. I absolutely believe that, and it's my observations over 30 years of clinical medicine. But that also talks to the health workforce that are culturally competent. I see nothing in here that helps us with that. We can have the best policies. I can have the best policies in the world. If I don't have the health workforce to deliver it, it doesn't matter. And the signals that we see is no day one pathway to residency for nurses, multimedia DJ, yes, you can come in, welcome, but international nurses, no, and no increase in next year's med school intake. If they were serious about increasing and improving the health workforce, these are very simple measures that could be taken, and a day one pathway to residency could be taken right now, actually, today.
So do you see anywhere in the plan that addresses chronic workforce shortages that are plaguing, as you say, the health sector?
So I like to give credit where credit's due, and I did like the part of the plan that talked about increasing the scope of general practice to do more, to maybe what we call radiology governance, be able to order more X-rays, CTs, MRIs than they might be able to at the moment, to increase the scope of general practice. I like that. I would do the same. I think that can be effective. Having said that, we have a health workforce crisis in primary care and general practice as well, but that was part of the plan that I would do also.
Now, an independent inquiry into Middlemore Hospital's emergency department has highlighted unsafe conditions for staff and patients. Last week, you called on WorkSafe to investigate. What are your most pressing concerns?
I worry about Middlemore, I worry about Mid-Central, I worry about Waikato, I worry about Christchurch. My concerns here are that the health in these hospitals, and indeed across the sector, that the health workforce may be working in conditions that are unsafe for them and unsafe for their patients. And what we know is a few months ago, 4 wards at Wellington Hospital issued PIN notices, provisional improvement notices, to WorkSafe. What we know is the aged residential care sector issues Section 31 notices when they feel they're unsafe, so that if there should be any consequences out of their hands, they've done the right thing to say, no, we put our hand up and indicated we were in trouble, you did nothing. So we need to see WorkSafe more involved. We need to have courage within the sector to do the appropriate thing and use the appropriate pathways to indicate that they're struggling, but fundamentally we need to do more with the health workforce, turn on the day one pathway for nurses.
National Party Health spokesperson Dr Shane Reti, thank you so much for your time today. Ngā mihi.
Kia pai tō rā.